Welcome to Board Certified, a podcast about medical licensing exams and building a career in healthcare. I'm Cassandra from Achievable, and these exams aren't just tests, they're gateways to your next career step. Achievable helps you prepare efficiently by focusing your time on what matters most for your exam, without the cost or rigidity of traditional prep programs. Start a free trial at achievable.me and use the code podcast for 10% off if you continue. Now let's dive in. So today we have Kelly Cook with us. And Kelly, I'd love if you could introduce yourself.
Sure. So I have been a licensed physical therapist assistant for the past 10 years now. I had my bachelor's in exercise science and then decided to pivot and go for PTA. I was always a tech. I worked as a tech and outpatient for about 6 years before I decided to go back to school. I worked in skilled nursing for the first 3 years, where I served as a clinical instructor for several students, and that made me love education. So I pivoted and went into full-time teaching for a PTA program in Illinois, Fox College, where I went. And then after 5 years, I was promoted to their director of clinical education, where I helped place students into their clinical rotations, supervised them while I was still teaching. And that entire time, I've still been dabbling in home health on the side, just PRN, a couple of patients here and there, which has been great to kind of keep my brain in the game.
Yeah. Awesome. Great. So today we're talking about becoming a successful PTA and what it takes and what to know and the steps to get there. So to start the conversation, what are some of the first steps that a PTA grads need to maybe complete after they pass the MPTE, and how do they then begin practicing in the field?
Sure. So every state is a little different, and every company, even within every state, is a little bit in terms of what they will accept work-wise from a newly graduated PTA. So some potential options, depending on where you're at. Some employers might allow you to practice as what's called a grad PTA or a GPTA. And that is working pre-licensure, kind of like you're on track to be a PTA, knowing that you're sitting for your boards. And then it's license pending, basically. So you might be paid a probationary rate at that point, and they're just kind of waiting for you to take your test and then get your license. And then bam, your rate goes up as soon as you are a full-fledged licensed PTA. That is a great transition. And I find that a lot of students try to do that because they usually will get a job offer with their clinical site that they were working for. And it's a great transition right into the working world because the trust is already there. You're already familiar with that. So that's a great option if they will allow that. If you are not going to be working while you're studying for your boards, which I don't always recommend for everybody, that's kind of very specific to each student. If you're not going to be working while you're studying for your boards, and once you pass your NPTE, they will give you a letter that says that you have passed the NPTE. Most employers, that is enough to say, yes, we can at least start your onboarding process. Once you have your letter, you need that to be able to then apply for your licensure within your state. Through ours, I'm in Illinois, so the Illinois Department of Financial and Professional Regulation is who does our licensing for all professionals. So you have to apply for your first license, you pay for your first license. PTAs, we renew our license every 2 years, and we're on the odd years. So usually students don't have to do like I'll go through like what requirements you need to renew your license, but usually new grads for the first license renewal, you don't have to do all that stuff, which is nice, kind of them to not make you do it all.
Yeah.
But then once you get your license, we're in the state of Illinois. Sometimes it's a little slow. It takes a couple of weeks at least. But at least on their website, they'll assign you a license number, even if you don't get your real license for a little bit. And most companies are perfectly fine with you working for them and paying you as a full-fledged PTA, as long as you have that NPTE pass letter and license pending.
Okay, cool. That's a good little segue into my next question, which is some common mistakes with licensure onboarding that can maybe delay starting the first job.
That's a great question. And it's most of the time it's either confusion with what's necessary. And I will say registering for the boards is actually far more confusing sometimes than registering for your license or applying for your license. You know, we have students, there's certain criteria that they need. They need a graduation certificate. They need all of this specific paperwork. And before they apply, they need to pay the testing center, and they also need to pay the NPTE. Like there's different things. And I know that process is always like a headache for students. Once then you have that NPTE letter, applying for your license through your state board is not that confusing. They're just like, here's my fee and I'm saying I've passed this program and ta-da, but they're just slow. So I kind of talked about working as a grad PTA. That is one of the potential mistakes, that if they are paying you a probationary rate before you have passed a board and you're stamping off as a future PTA, that can really mess with documentation if you end up not passing the boards. And then sometimes the company can choose to not have you as probationary if they don't want to wait for another 6 months for you. They may kind of demote you back to a technician position and kind of decrease that pay again. So working in between can be a risk, can be a gamble. So I say it's really only for those that are most confident. Or I say it can benefit you if you're somebody who like needs to be working with the things you're practicing and with the things you're studying, as long as it doesn't take away from your study time. That's always how I get, like, if you're somebody that can balance it, that know yourself. But within that, I would say other mistakes actually with us, because we're right on the Illinois border, actually come from attempts with dual licensing, I would say. So we're right on the border of Illinois and Indiana, and a lot of our students and a lot of clinicians in this area choose to have a dual license, one in Illinois, one in Indiana, because they often can cross the borders. So Illinois has higher accreditation standards and like things that you need to do to get your license. So more often than not, as long as you hold an Illinois license, that will translate into a lot of other states. Like, yes, you passed the Illinois standards. But if you take it in Indiana, sometimes it's not always vice versa. And that can be harder. And then you have to end up taking like another version of the test or something. So it's knowing your state practice acts and knowing the standards. If you're going to be trying to apply for licensures in different states, that can be where some of the tricky stuff comes in.
Yeah, that makes sense. First of all, like you said, there's different state licensing regulations, and then also depending on where you're working too. So really make sure you're understanding all of it and all the opportunities too that come with that. Like you said, dual license, that could open
It's a
up
great,
jobs and stuff.
it can be a great thing. You have to be very on your P's and Q's while you're navigating it.
Yeah. Yeah. Great. So then what would you say are like best expectations for a new PTA as they start practicing in one of their very first roles?
Great. I think that highly depends on one, what their last clinical rotation was. Is it something that they're very familiar with off the bat? Like, let's say they ended off their last clinical rotation in a hospital and then their first job is also in a hospital. It's fresh. They're in that mindset already. They're familiar, if it's even in the same hospital that they just did it in, the transition is very smooth. They're
Right.
familiar with the EMR system. They're familiar with how everything runs. They know faces. So there's such a big variety. If it's completely new, which I'd say go for it. I'm always all for it. You should work in every single setting. You should diversify yourself as much as possible. Don't go for the familiar. Don't go for the comfortable. Challenge yourself, because the younger you are in this field, the more you should be trying to diversify. You're not getting in one spot and getting comfy just yet. You should be using all of your licensure. You should be using all of your brain. So I love when students, choose a completely different setting and then are like PRNing and doing something else on the side that's also totally different. It's such a great way to hone your skills, because you have not honed them yet. Just because you've graduated, it takes a lifetime of practice. We sign up to be lifelong learners. You should always be humble enough to know that somebody next to you is doing something different or better, or, I can learn from anybody. They are transitioning into that. Most of the time, they will have like a mentorship, depending on the company, but I've found that to be the case in most companies, where PTAs. So oftentimes we're going to be paired with a supervising PT. They also might be assigned like a go-to seasoned PTA that, like, if you have questions, they're doing your onboarding. They're the one that you go to if you don't know where like the oxygen tanks are, like, who knows, whatever the question is. But there's usually some level of mentorship. Oftentimes, PTAs that are just starting new grads might have lower productivity standards to start. So if their seasoned clinicians are expected like a 92% productivity for the day, maybe your new grad starting off at like 85. And then maybe that's like a 3-month probationary period, or whatever their company is. Or if their caseload in an outpatient setting should be 20 patients a day, your new grad's starting off with 14 or 15, until they work up to it. So they should know that they're not expected to be a PTA with 10 years of experience when they first go into their field. They know you're a new grad. It's okay. Like, there's leeway, there's a curve. Don't expect that they're ready for you to, like, come in, which I hope you can, and I hope you should. And show them up, but you're not just like getting thrown in with the wolves.
And I think too, like really any job, like there's such value in being comfortable asking questions, being comfortable asking about how do you do things? What is it like here? And just really trying to do everything you can to get a feel for the environment as quickly as possible. Because the more comfortable you are, like right off the bat, it's going to be so much easier to do your job and to get into the flow of things.
Exactly. Exactly.
So, what would you say are like some of the best qualities that make students stand out during clinical rotations? And then what are some of the biggest mistakes that you've seen or that you've had experience with? And then how can you maybe avoid them?
That's a great question. And I now being on both sides of it, then I was a clinical instructor. Then I was the
Yeah.
supervisor for the student and dealing with the clinical instructors and hearing from the clinical instructors. This is a fantastic question because seeing it from all angles, knowing what it took as a student and the qualities that my CI liked about me. And then the only thing that not the only thing, but one of the main things that I hear repetitively is initiative. If a student comes in and hears something one time, and then the next time they don't have to be told. If they come in and they're 30 minutes there before their CI, they've chart reviewed, they've pulled all their stuff already, and your CI comes in with their coffee and they're like, we're ready to go. Here, I pulled all this for you and this is ready. I'm not saying like to be, like a suck up or anything, but it is being prepared for your work day shows that you are there to learn, shows that you pick up on things quickly, shows that you are putting in the work to be ready to learn other things. As soon as you learn something and you bank it and you don't have to be told again, that is one of the most impressive qualities in a student. I'm not saying you had to be the strongest student. I'm not saying that you shouldn't be asking questions. I'm not saying, like, if you come in and you're ready to go and you're ready to learn, let's go. Like, I can teach anything. I can't teach that. That's a very hard quality. Like that, when a student comes in with that, it's gold. And then on the other side of that coin, I would say one of the hardest things to deal with is a lack of initiative. I can tell that you think you're good already and you have learned all you can learn. And if you're not really open to feedback and you're not really open to taking in more, what are you doing here? Like as a CI, that is very frustrating for somebody that's like, again, you signed up to be a lifelong learner. So if you think you've gotten everything you can out of this, you're not looking hard enough. You're not looking for the questions. You're not looking for how you could get better. We should never be resting on our laurels when it comes to patient care in particular. The one thing I tell my students constantly is, if that was your grandma, did you do everything you could for her? If that was your mom, are you happy with the care you just gave to her? Would you be happy with the clinician of how you just treated her? Couldn't you do more? I had 5 more minutes. What else could you do? Like, use it. Like, there should never be a stop button. There should never be that was good enough. I'm good. And that can be one of the more frustrating qualities in some students. So,
Yeah. It's basically just, are you engaged or not? And that really shows your level of care and passion about it because, like you said, you are signing up to be a lifelong learner. Are you actually going to fulfill that duty, or do you think that you're already the best and you're going to get humbled probably really quickly if you have that mindset?
and it happens. And that's one of the things, like, I can't control where you're going to go. I can't control, who you're going to work with. And you might get humbled very quickly. And sometimes that's a life lesson that I can't teach you. And I can only do what I can do for you. You passed all the tests, you did all the things, and you're going to
Yeah,
be who you're going to be out there. I can't.
exactly. Yep. You can only do so much, and the rest is on the student. That's up to
It
you.
is. We're all adults. That's what you're here to do.
Yeah.
And if that's how you want to
Exactly.
live your day to day and your lifelong practice, that is your choice.
Absolutely. So then, since you have such a well-rounded experience with the different roles you've had, do you have anything that stands out, like unique skills or lessons that you've learned from these or that maybe these specific settings offer? Whether it's the skilled nursing, inpatient rehab, the home health, is there anything that really stands out to you as unique compared to maybe other settings?
It's a good question. I think that's so specific because everybody's got different tastes, right? So I can't see like I myself am partial to
Right.
a geriatric population. I am partial to skilled nursing. I love my old people. I could sit and talk with, Bob all day long.
Yeah.
It's just my favorite thing in the world. Do I recognize though that all my students are not going to be that way? And that's okay. But you're all into whoever you are treating, whether that's a 2-year-old, whether that's a 15-year-old, whether that's a 40-year-old, doesn't matter. But what's cool and what I need my students to remember all the time, and I remind them constantly, your license is all encompassing. So it does not matter that you want to work for a professional athletic team and that's the only people you're ever going to treat. And one, good luck to you. That's those positions don't open all that often. Sorry if you do. But your license states you could treat that 2-year-old. You could treat that 40-year-old. You could treat that 90-year-old. Your license states I could stick you in a hospital. I could stick you in skilled nursing. I could stick you in an outpatient clinic, and you have the skills to get by treating those patients. That's what your license and that's what this board exam entails. So just because you know what you're going to do, more often than not, when students go out to their first clinical rotation, I rock their world with, I put them in a setting that they didn't think they were going to like. And it's like, oh my God, I think I actually want to do skilled nursing. Or, oh my God, I figured out I actually hate kids and I don't want to do pediatrics. You know what? There was value to that then. Even if you hated it, then it tells you something else. That's okay. So that's what I always tell them is there's something to take away from every clinical, whether it was the best experience of your life or whether it was the worst experience of your life. And you're like, I never want to work there. Guess what? You learned something. Okay. It happens. But your license means not just one thing. And just because you don't think that you're ever going to use the information that you're learning in this class, your board exam tells you that you will. Your license says that if you happen to get a spinal cord patient, you can treat them, even if you never want to and you hate treating spinal cords and blah, blah, blah. Doesn't matter. Your license says that you are able to do stuff.
Yeah, that was actually perfect because that was my next question is like, what advice do you have for students to find out what the best fit is for the practice setting? And it sounds like it's really just try it
Try
out. Yeah. Try it and
Try
see
it
how
all.
you feel. Yeah.
Try it all because something will click. And I love those students that click in multiples and they're like, do this, I work I do 2 days a week in this clinic and then I can go to the nursing home for these other 3 days. Like, that's my favorite thing. You get so much exposure and too young to find your niche and stay right there because you're really just scaling all of your other skills that you learned by then only sticking in one realm. The time to do it is when you're fresh and when all of this knowledge is fresh in your head, because I'm not saying that you can sit in one place and do, treat the same patient population for 10 years and then be like, you know what, I need a change. I'm going to go to the hospital now. I'm not saying you don't know those skills and you can't do it, but it's going to be a heck of a lot harder to drag up all that knowledge from the back of your cabinet of your brain. You learned it way back when. You might as well keep it all fresh now. And then eventually, absolutely, you find a favorite, you stick where you stick. I love that. But even within that, you should be taking continuing ed. You should be never stopping learning about your favorite population. And you should never be stopping learning new techniques within that given realm. So there's never a stopping point where you're like, I'm good and I'm going to stop here.
Yeah. Yeah. Such a good point. And why not get all the knowledge you can? And what better teacher than experience itself, especially when you're just starting out? Not only will it help you decide what you like most, but you're going to just have such a massive tool belt on your hands because you know how to
Definitely.
deal with all kinds of different situations.
Yeah. And most programs
Great.
like our wording and our syllabus require that you do 2 completely different rotations. Like at least it's different, like patient population or different, diagnoses or whatever. Most of the time when I was placing, I'm trying to do like 1 inpatient and 1 outpatient. So that again, you get as much variety as possible. You get exposed to something that you're not familiar with. Everybody, works for these huge physical therapy companies and they're techs already, which is great. And they're like, you know what? My company wants to hire me as soon as as soon as I get my license. Like, that's fantastic. Who doesn't want to have a job lined up already? But let me just throw something at you then. I'm not going to put you in anything like that then for your 2 clinical rotations. I would be doing you a disservice if I put you in a very similar setting to that. If you know that's where you want to go, good for you, then it'll be there. So I'm going to use this wisely and give you two things that will just completely blow your minds and diversify you. And who knows where you'll end up now.
Exactly. And who knows, maybe you're like, "Huh, yeah, I'm going to go that direction anymore."
And sometimes that's the case and sometimes it's not. But like I said, then it solidifies then. Major decision easier. Fine, great. Then I did my
Yeah.
job still.
Yeah, exactly. Great. Is there anything that you want to touch on before we wrap up?
Well, I just think that as we go, I'll say, and it's been something that's been more nationwide, and every state is specific on their continuing education that you need every 2 years to renew. In Illinois, we need 20 hours of continuing ed. And they're very specific. You need a couple of hours of ethics. You need some for sexual harassment. You need some for implicit bias, cultural competency. So they're very specific. Use your other continuing ed to explore what is cool to you. They're going to continue adding ones that are mandatory. They're not always the most fun. Yes, they're important, but use your continuing ed to better serve the population that you treat. Use it to explore things that are new and cool and different. Don't do things that are familiar to you. Don't do things that are already in your wheelhouse.
This has been Board Certified, hosted by Cassandra from Achievable with Kelly Cook. And Achievable has a great online course for the MPTE PTA. You can try it for free at achievable.me.